Tēnā koutou, ko ahau, ko panikiri te maunga, ko waikari moana te moana, ko waikari tāheke te awa, ko Ngāti Ruapani te iwi, ko ahau ko te waimātau. Nō reira, tēnā tātou katoa. My name is Angie Smith, and the reason why I got involved particularly with the Health Quality Safety Commission work was in 2017. My mother had a stroke, and that I think was the start of my journey through this health journey, was advocating for my mum and advocating around the appropriateness of the treatment and the rehabilitation, because it was about Te Reo Māori was really important to my mum and her recovery, and yet there were no staff speaking a language that she is more comfortable with. So the importance of allowing whānau members to be by her in those moments when she was really vulnerable, and having that language, needing to be there to translate for my mum, was important. So it is really important from a Te Ao Māori worldview that we build a relationship with whānau, we build a relationship with consumers, we build a relationship with even our healthcare workers, because if there's no trust, then the whānau won't come forward, the whānau will be hurt, the whānau would not know how to get help, and it leads to more unnecessary harm, trauma, unnecessary deaths.
In complex systems like healthcare, it's very likely that under some conditions things come together in really unexpected ways, and harm can result from that. And so it's really important that we understand that harm is something we should try and reduce, but it's something that's part of our everyday. It's about how do we manage risk to try and prevent harm. So because we can't entirely get rid of those risks, it means that we have to find ways of engaging families when harm occurs. It's not about saying these things are inevitable, or that it's just one of those things. It's about making sure that we, front and centre, focus on how do we understand the experience of harm and support patients, their families, but also the staff involved when they're affected by these events. So the big changes in the new Healing, Learning and Improving policy are really focused on making sure that we meet the needs of all those who are harmed or affected by an event. So that's patients, their families, but also the staff involved, and making sure we deal with that. The second aspect is really focusing on system learning. So trying to understand what was going on for the people involved at the time. Why did their behaviour make sense? What's so normal about this event, and what does it tell us about the trade-offs or constraints or risks within our systems, and using that to then improve our systems to make care better all the time. And I think we all have a part to play in that. We can be involved in telling our stories about what was going on at the time of the event. We can be involved in thinking about what does this tell us about our systems, and we can be involved in trying to understand the experiences of patients and families and work to restore those relationships. This is a policy that affects everyone in healthcare, and so I think it's really important to go away and look at the policy, and then to understand what are your local processes and how can we all be part of healing, learning and improving from harm.